Well, it's like any of the MPS disorders, of course, if there's often a long diagnostic odyssey, as we say, because they're not necessarily identified. I think that with more information, more publications, and so on what we're finding, will increase the possibility of diagnosing patients earlier. One characteristic feature or different feature for MPS VII is the high incidence of non-immune hydrops fetalis. This is a fetal disorder where fluid accumulates in at least two fetal areas, and the etiology is not fully understood. Typical areas of accumulation of fluid is in the pericardium, the pleural space, in the abdomen with ascites. Even the skin can appear edematous. This is often picked up during pregnancy on routine ultrasounds, typically in the second trimester, maybe a little bit later. So as I mentioned, we don't know the true etiology of non-immune hydrops. There is some relationship with congenital infection, congenital heart disease, and so on, which you can see in other LSDs as well. There is an incidence of NIHF, but not as high as in MPS VII, where with our data we found a prevalence of 68% of cases that we were at least contacted about for potential treatment. It could be much higher than that. We don't know. In the literature, it was previously reported being about 40%, but in the cases that that we mentioned, 37 cases worldwide, there was a history of hydrops. So I think the perinatologists are becoming more aware of this and are investigating more. Typically, they would rule out the most common cause of NIHF and then essentially stop. So now I think that given the information that we have, it would be important for those pregnancies to be further investigated with looking for lysosomal disorders, but particularly for MPS VII.